Welcome to Face It, the Aesthetics podcast. Today I'm here with Dr. Arun from Aesthetics and his patient, Lorraine, who underwent her 10 years younger skin journey. And we are delighted to have her here today to show you the results, but not only show you her amazing results, to take you through step by step the journey that she went through. Lorraine, welcome back.
Oh, thank you.
So let's just start and let's just dig right in there. First and foremost, we spoke to you maybe 5-6 months ago it was. So you started your journey in February and you really were not feeling good about yourself. Tell us how you were feeling back then.
I was feeling amazed. It's all down to my skin due to smoking and sunbeds and not using the proper stuff.
And a lot of people were saying that you looked a lot older than what you did, and that's why we underwent this journey.
Yeah.
So what sort of age were people actually saying that you looked like?
My 50s.
Late 50s?
Yeah.
And what age are you?
40, well...
You're 50 now, but when you started this journey, 49.
Yeah.
And tell us, how has the journey been?
Well, it's been kind of crazy, because I've got a few different things done, but I got the radio frequency microneedling done, and that was a wee bit uncomfortable, but best results came from that. So
yeah,
there was a wee bit of puffiness around the face and all, but then the swelling did go down, and it kind of gave me better results.
Yeah. And how do you feel right now?
More confidence. If as I said to you before at the start, if anybody had said to me 2 years ago, 3 years ago, would you have been here? Now I would have been like, no, not a chance.
Yeah.
Now that just go for it.
Yeah, and you look amazing.
Thank
so
you.
Arun, talk us through the whole journey.
Wow, what a journey. It has been many, many appointments and many visits. A lot of driving because Lorraine's from Donegal.
Oh, wow.
So she's been back and forth to both Derry Clinic as well as Coleraine. The majority of the stuff in Coleraine. So it's been a lot of driving and a long, hard journey. So yeah, I knew Lorraine from the past. So she'd been with me for a few appointments beforehand. So then I was thinking of doing like a 10 years younger project, and I thought of Lorraine as a perfect patient for it for a few reasons. Number one, I knew she had some reservations about the way she had looked, and that she wanted to look a little bit younger. So the reason why I picked Lorraine was because of two reasons. Number one, she had been a patient of mine from before, and I knew that she had certain reservations about her skin and the way she looked, and that she wanted to improve it. And I knew that I could potentially get her down from what she had thought she had looked like in her late 50s, early 60s, down to the age that she was at 49. And the other reason why I picked her was because she deserved it. You know, she was a patient who's had a very difficult life, and it had contributed to the way that she felt, the way that she looked. And I thought, out of any patient I have, she would have deserved to go on to this project. So yeah, we kicked off running in February with a skeptical plan, but carefully devised a plan for her over the next 6 months, which was all about treating her fine lines and wrinkles, deeper lines, volume loss, collagen, elastin production, the whole lot. And we'd staged it in different kind of elements, from the very start to ending up today where we've finally completed it. And it's not only as well just about aesthetics. So, it's about the whole package.
It's the whole journey. It's how you were feeling. I remember speaking to you, and if we go back, you will see even your demeanour and how you felt about yourself.
Yeah.
You said that you felt tired. You just felt there was no energy. Obviously, you smoked a lot in the past, and you felt that had, a burden on your skin. Yeah. But even watching you come in today, your whole demeanour is completely different. So talk us about, how this journey has made you feel internally, mentally, for your own well-being, as well as how fabulous you look on the outside.
What did you say to me?
How has it made you feel? How has this journey made you feel mentally, physically, and your whole overall well-being?
Well, at the start, I thought, what am I doing? My friend says to me, do you think, no, she had spoke to me about it, and says to me, "Do you want to go for it?" And Dr. Aruna had approached her about it, and I says, "I don't know. I'll see what I don't know." And then I thought about it then, and I contacted Dr. Aruna then, and I says to him, "Yeah, I'm going to go for that."
Mm-hmm.
And your confidence, it gives you a wild boost.
Yeah.
Do you know, like you could have been going about like I'm not a person that goes out. I know a nights out only when I really have to, but it leaves now that you can go out nights and you can feel a wee bit better about yourself.
Definitely.
No matter what anybody says,
Was there any point through the journey that you felt that you were just going to give up, or every treatment that you came back for, did it give you a little bit more? Was it growing more and more, or where you're like, oh, some of these treatments just weren't for you?
No, there was never any doubt in it. I never at any point said, no, I'm not going to give up on this. I never did.
And when did you look in the mirror and see the difference? You were like, wow.
Well, Dr. Arun says to me, "Has anybody noticed?" And I says, they have, but I don't see nothing, difference about it. Like, and I'm like, what? But eventually, like, I did see it, like.
And have you seen your previous pictures yet? Your before and after?
Yeah, I've seen
She
some.
kept a copy of it.
Yeah. And when you look back, you sort of see.
There's a huge difference, to be fair.
And relating to that confidence thing as well, I actually noticed, because I knew Lorraine before this all kicked off, she had a certain level of confidence. And then I saw her every single visit. She was like bouncing off ideas to her friends about potential treatments. She was so well educated about treatments. She was like my little ambassador rolling around Donegal. But she had so much confidence as near the end of the appointments, in the last couple of months, just with the way she's speaking about aesthetic treatments. You wouldn't have heard her speak about aesthetic treatments at the start of this. Not a hope in hell. Whereas now is a completely different story.
But I think that's the important thing that people need to understand. People think it's about vanity and it's about how you look, but it's not. It's more than that.
Yeah, it goes deeper, doesn't it?
It does. And, if it makes you feel good internally,
100%.
like your whole demeanour is so different from the day you walked in here the first
That's right.
time. And
Do
then,
it for you.
Yeah, absolutely. And then you talk about it, and you're like, your family and all have been in and getting certain treatments as well.
Yeah.
It is fantastic to sort of see that difference.
100%.
What out of all the treatments would have been your favourite?
To be fair, the microneedling,
Yeah.
I know it was a wee bit uncomfortable, but that was my favourite.
Yeah, the radiofrequency microneedling is a tough one because, because the needles are going in slightly deeper than what you would do when you get your standard microneedling, and then you have the radiofrequency element of it. We have to numb up the skin. So numbing cream can only take you so far, unfortunately. However, the benefits from that procedure outweigh the pain in most cases. Now, we've had a few patients that come through the clinic who do find it quite sore, some patients who don't find it as sore, but it really is to do with the depth that you're going. So again, it's adjustable with what we can do. We can lower the settings a wee bit, but in most cases we want to make sure that you're getting the best results with what you're doing. So I think we managed through it, but again, you noticed the biggest differences following that, and I did as well.
Yeah.
The static lines that you had in her forehead and even in her cheek area. After, I think it was the third session or the second session. It was the second session when she was coming up to it when we really noticed the differences, and that collagen and that elastin was really kicking in.
Yeah, you can really see the difference on the microneedling, and I absolutely love radiofrequency microneedling for crepiness, for anything. I do think it's important to let people understand it's a journey and it takes time. How many microneedling RF sessions did you have?
Yeah, we actually planned to have 3 in the project, but we ended up doing 2, and we did a little bit extra of something else. So we started out at the very start with some dermal filler to look at readdressing the volume within the face. And I know we can pull up the before and afters here at this point. There's a little bit of volume loss in Lorraine's temple, as well as her buccal fat pad, which was making her cheekbone look a little bit over-exaggerated. So what we did was try to create a little bit of volume in the back of her face. We then brought her back to start our radiofrequency treatments, and in between each radiofrequency treatment we did some Alonce. And Alonce is a collagen stimulating dermal filler, so not only addressing that volume, we also address some of the skin issues she had, creating some collagen production. So we used that for volume, and we also used it for her skin, essentially. We then went back to the radiofrequency microneedling and did some PRP and polynucleotides, which each of those sessions. And then nearing the end, we started addressing some of the finer details, like addressing some of the lip volume. Now, again, when people get lips done, it's not all about just making them massive and plump and big juicy lips.
Yeah.
What we wanted to do is just give her a natural lip that nobody's really going to notice she's had done.
Yeah, that's what I was going to ask you with your lips. And a lot of people do fear getting their lips done because they don't want to make them look plumped and lipped and stuff, and because it's renowned for being sore as well. But there is, how did you find it?
Well, when he mentioned lip fillers to me, I thought, oh my God, these is going to be massive. I was scared, to be fair.
Yeah.
But to be fair, you wouldn't have noticed.
No, but they look fabulous.
Yeah, like for even to say they'd have to look twice at you, you'd have to say, you know what I mean?
You
So
maybe
it wasn't
notice the
actually- it
next
turned out
first
alright.
day or two because of the swelling, but after that, you wouldn't notice a thing.
Yeah.
It was turned out okay anyway.
And when it comes to lips as well, we talk about younger age groups and older age groups. It is very different
Completely
because
two
the
different
lips are aging.
spectrums.
Yeah.
Two different spectrums.
Explain to me what that difference is and why that is so different.
Well, in a mature patient, you need to look your age. Mature patients often don't want big lips, and they just want a subtle natural enhancement, whether that's creating a little bit of volume and just giving a little bit of contour of the lip. Whereas you have a younger patient who wants a little bit more volume, and it may be sorted to the dimensions of their face. So whenever I do lips in a mature patient, I'm often using a mixture of using a needle and a cannula. And the reason why I use cannula is, again, the majority of the patients have quite thin lips, and what I want to do is place some product right at the very back posterior aspect of the compartment of the lip to recruit it back out again, so that they're not too pouty. And that's the issue with mature lips. Using a needle, I find it quite difficult to be able to get the product where I want it, whereas when I'm using a cannula, it's a lot easier. It's also a little bit less traumatic for the patient.
Yeah.
So by doing those different techniques, we're able to give that patient a more natural lip, or for mature patients, give them more natural lip and nothing that's too volumized or too pouty.
Yeah. So how many mils has Lorraine had on her lips?
Well, she had a different product to what I would normally use for a younger patient. So I would usually use a product called Miley Define, which is very good at addressing volume. But I didn't want to use that in Lorraine because of the issue with volume. She didn't want a big lip. I didn't want to give her a big lip. I just wanted to readdress the hydration and also some of the fine lines. So I used a product called Precise, which is a lot thinner product. Now, we used 0.8 mils, which sounds like a lot to put into a lip, but bringing Lorraine from where she was to where she is now with 0.8 with that specific product to address hydration rather than volume was the perfect amount for her.
Okay. And let's talk about the dermal filler, because you said about the temples and their cheeks. So talk about all the areas that you have addressed for dermal filler with Lorraine.
So with Lorraine, we addressed her temples. Then we addressed the preauricular area, the medial cheek, the back of the jawline, the chin. And we also addressed some of the smiles lines she had here with the Alonsi to give her that volume and improve some of the fine static lines that she had when she smiled. We then obviously addressed some of the smoker's lines and the lip with dermal filler.
Yeah. And they say with dermal filler, it is targeted at an older, mature patient. As you've seen and as you've spoken about in your recent editorial that's out with Local Woman, with regards to younger ladies getting the dermal filler, making them look older. And we have Lorraine, who now we've got dermal filler, who has made her look younger.
It's the way that it's used. So it's not to say that young patients shouldn't get dermal filler. There is certain criteria in which it can help them look a little bit younger or make them look more refreshed, is my kind of go-to line. The majority of the times when I'm using dermal filler is to make them look refreshed. Now, it's with regards to how much product you're actually using. Younger patients are getting overfilled, which then makes them look older because they have overfilled cheeks, overfilled jawlines, big lips, which brings their age up. If you're in your 20s and you're getting an insane amount of product, you're going to be looking in your 30s. Whereas those sort of patients should be getting less product and not looking as overfilled. Where it's a little bit opposite when we get to a mature patient who hasn't had any work done before. We then do need to use certain amounts of product to make them look younger.
So, Lorraine, talking about all the procedures that you have had, would you recommend to other people to get this amount done?
Yeah.
Or what would you say, you know what, yeah, definitely go and get this one done. This was absolutely a game changer for me.
That was the quickest yes ever.
Yeah, I would go for it, yeah.
Yeah.
And I would tell them to go for it as well. If it makes you happy, go
Yeah.
for it. Yeah.
And what was the biggest sort of outcome that you felt that you were, when you looked or you put your makeup on, that you really noticed a difference? Was it the texture of your skin? You don't wear makeup, that's right.
No.
But that's a good
No.
thing because you can go out.
No, I do. To be fair, I do wear makeup whenever I go out nights, but it's not very often I do go out, you know.
Do you know what? We got her the sheer tint SPF. So again, not along with all of these procedures, we had Lorraine on a skin plan from day one.
So let's talk about skin. What skin products did you give Lorraine? 'Cause were you used to using skin products originally?
You see, I haven't used skin products in a long time. It was just a wash and go, really, because like I babysit my grandkids, you know,
Yeah.
and never had I been using cream for an awful long time, and the cream I was using was Nivea.
Okay.
So then Arun set me out this, give me all the cleanser and toners and moisturiser and SPF, and then the last one I got from was a serum. I can't even remember the name of that, but it's all the PCA.
Your skin is glowing, and it is probably one of the things that I have noticed out of anything is that really sets out. You can just look at your skin compared to what it was. It was very dehydrated,
Dry,
dry.
yeah, it was.
You know, you look tired, whereas now
Yeah.
you're literally
Yeah.
glowing.
To be fair, it's even softer.
Yeah, it is. It
More
looks
smoother,
amazing.
yeah.
So talk us through the skin products that you gave to Lorraine.
Yeah. So we had her on just a basic skincare regime. You know, a cleanser, toner, moisturiser and an SPF. During the end of it, we increased that to a serum that she used, as well as a hyaluronic overnight mask. But what I didn't want to do was overload her skin with too many products because we were doing all the in-clinic skin procedures as well, such as the radiofrequency microneedling, the Alonce. Near the end of the treatment, we then focused on some peels, chemical peels, such as a perfecting bright and even peel, now it's known as, and Diamond Glows, which we just recently got into the clinic, really to clean out her pores, refresh her skin, and pump some good products into her skin. And then we finished off with a red carpet facial, just to give her a nice glow.
And how long will the effects of the treatments that she's had, their filler, everything, how long is she going to get out of that?
I often get this question asked all the time. Every single consult I get asked this. So there is a timeline on certain things. You know, we have the likes of Botox, which everyone is fully aware of. You know, that has a time limit and that is gone. When it's gone, it's gone.
Yeah.
Whereas all the procedures that we're doing at the minute with Lorraine, all the procedures I do with most of the patients in the clinic, it's like compound interest in a bank. You know, you get a treatment, it'll give you a certain effect. And then as you naturally age, it will come down. And then you'll probably be back for another treatment and another treatment. So if you were to blankly ask me, how long does radiofrequency microneedling last? It could last up to 2 years. However, within those 2 years, you're probably going to have another treatment done of something else, or you're going to have some skin peels, or you're going to have some skincare, or you're going to have some dermal filler. And all of those things are contributing to longevity of the treatment you originally had. So, you know, I would like to see Lorraine again in a couple of months, maybe to have a skin peel, or maybe another radiofrequency microneedling treatment in 6 months and a year, and so on. So it's not like she's suddenly going to go back to the way she was in a year and a half or 2 years' time.
Yeah. And is there any time that you say enough is enough? Or, you know, if someone is coming back for filler, is that too much? If they come back
yes.
and you're like, no.
100%.
You know, when do you say stop enough?
100%. When you can usually gauge red flags, but there is always times where you have to say no, unfortunately, in this industry. And it's a difficult one to have with patients as well, because, you know, they have that sort of feeling about them, and they want you to do this procedure. You don't want to lose them as a patient, but then you got to say no in certain scenarios where you don't feel it's right to do. Whereas, well, in Lorraine's case, you know, every procedure that we discussed about, I think you were happy with to go ahead. And I think for the next 6 months, the next year, you know, this is how far we've got in 6 months.
Yeah.
By the way, like, I can't wait to see what the next 6 months hold and the next years hold after that, to see how far we can take things. But in 6 months,
It's crazy.
are remarkable.
And do you think you're going to continue, or what specific treatments are you going to say, yep, I'm coming in, I've already booked in for that, I'm going to maintain that?
I'm definitely going to come back for microneedling on it, definitely.
Yeah, I think you really enjoyed that one.
Yeah.
I agree with you. I think it's unreal for anybody who doesn't want
It leaves you a bit
injectables.
puffy, but it goes down.
Yeah.
Goes down,
So then let's talk about that with regards to, you says you felt a wee bit swollen afterwards, and you know, how long did it take for that to settle down?
It didn't take long at all, to be fair. I'd say a week to be honest.
Yeah. And
That
did
was
you
more-
instantly feel the tightness, or what was your experience of
I
everything?
actually felt the tightness of it, but I could feel the puffiness and the tightness. But then once the puffiness went away, everything was just normal again. You know?
And how often did you get? You've had 2 treatments of that, and how much time in between each treatment?
4 weeks.
4 weeks.
So we didn't feel we needed to do a third treatment because her skin was really getting under really good condition. So we decided to move on to the next step, because again, we wanted to do this in a 6-month program, in terms of getting her from where we thought she was at 59 plus to where she is at 49. So we really wanted to focus on other treatments as well. But the 2 sessions of radiofrequency microneedling combined with PRP and polynucleotides did an amazing job for her skin. So, you know, in the next 6 months, next year.
So going
continue those
forward,
treatments.
what would you prescribe, or what would you suggest?
Going forward, maintaining our skin with skincare.
Mm-hmm.
SPF, please, because the worst thing that you can do is not wear SPF and reverse a lot of the stuff we've had very quickly. You know, a monthly peel, chemical peel, diamond glows, and maybe in 6 months' time, maybe another few sessions of the radiofrequency microneedling.
So that would be it. You wouldn't say come back from the RF microneedling for a while.
Oh,
you'd
no,
be saying
at least a while.
okay. So how many months after, since she's got all this done?
Well, again, it's where you want to be. So at the minute, you know, I could say to her, come back in a year and a half time for another course of radiofrequency microneedling.
Yeah.
But I'd like to see her again sooner, so that we're, again, it's like compound interest in a bank. You're putting a certain amount of effort to get you from where you were to where you are. And then you want to maybe do a couple more sessions to bring you even further.
Okay.
So I'd like to see her back whenever you want to come back. And again, as I said before, it's not just about all the injectables and all the non-injectable treatments we did. This 10 years younger project was about everything. You know, her confidence, the way she felt, the way she looked. We did her hair, and a big thanks to Victoria from VVault for bringing her up today to get her hair done. Her friends who gave you a nice new outfit to wear. And now, obviously, we didn't do makeup because, you know, she doesn't wear makeup, but she's got a lovely sheer tint SPF on today.
But even your jawline and everything, you can start to see the shape of it. You know, how are you feeling right now?
I feel great.
Yeah.
Yeah.
And if somebody came up and said, I think you look 49, 50, what would you say?
I definitely do.
No, I definitely do now.
Yeah, you definitely do.
100%.
And as you see from the before and afters, because we took a lot through the whole process, the difference is amazing. So I wish you all the best, and I hope you continue your journey onwards.
Thank you.
Thank you.
Thank you for coming into my life. Because honestly, this has been the most enjoyable like case study. Like, I've done a few minor things, but this has been great because of me having to see you every few weeks, every month, and the change and your confidence levels, everything. I've never heard anyone a patient talk about skincare like she has.
Yeah.
She's sitting talking to all of her friends about skincare and what to wear.
You become so knowledgeable.
But it was the fact that not using as much, and then to go using everything that you have. And then if you miss a night, you're like, oh, merciful God, I missed that. I forgot to do that last night. And then I would say, did you tell me to start doing that at night time again? Yeah. You'd be like, yeah.
Well, good luck, and we hope to see you again. Thank you for tuning in. Stay tuned as we reveal more case studies and more journeys through skin.